Good afternoon, everyone. Hi, I am Dr. Shayla Toombs-Withers, a family physician here at Essence of Health Wellness Clinic. Thank you for joining me this afternoon. As the coronavirus pandemic becomes more widespread, more cities are revving up their recommendations and mandates to get its citizens to stay home. It is very important to follow this recommendation right now, and I'll share with you why that is. Also, on social media, I've also seen multiple people concerned about possibly gaining weight during this extended time indoors. I've seen this jokingly referred to as the COVID 20, comparing it to the freshman 15, which references the weight gain that some freshmen in college experience while living on their own for the first time. So, I also want to share with you today some tips to avoid the COVID 20. Now, let's begin by talking about really just where we are in our country, as well as where we are here in Tennessee and in Chattanooga as it relates to the coronavirus and this pandemic. So, in terms of the United States, there are currently a total of 213,144 positive cases. Now, if you just think back even to last week, and I presented it in last week's live talk, there were 68,440 positive cases in the United States. So we have more than tripled our total number of cases in our country just over the past week. Um, the highest number of cases that we are seeing currently are in New York, New Jersey, Florida, Louisiana, Illinois, Massachusetts, and California. And also, if you look back on the data from last week, some of these states weren't in this top highest cases level last week. And so there are a couple of reasons as to why that has changed this week. One of the biggest reasons that will stand out is that more people are doing more testing right now. And so that will certainly make a difference in terms of seeing more and more positive cases just because we are testing more. And then the other part to it is just that people are spreading this virus amongst each other because still with these high numbers of cases, what they have found is that most of these cases aren't actually travel related. They are more contact. They're becoming more and more contact related. So that's just, brings home that point as to why we are continuing to recommend that people just stay home. Now, if we look at the state of Tennessee here, currently in Tennessee, there are 2,845 positive cases, 2,845. And this data comes from as of yesterday afternoon. Now, also, if you compare Tennessee's data to just last week, there were only 957 positive cases. So we have also seen a doubling, close to tripling our number of positive cases just here in 1 week. Um, if you look at the ages of these positive cases, the age group of age 21 to 30 is leading the way with 665 positive cases here in Tennessee. Next is the age group of 51 to 60 with 484 positive cases. And then it's age group 31 to 40 with 456 cases. So again, that brings home the fact that we're still seeing that population of age 21 to 60 still with the most number of positive cases of coronavirus here in Tennessee and in a lot of places. For reference, the top three counties here in Tennessee, Davidson County is still leading the way with 617 positive cases, followed by Shelby County, which has currently 570 positive cases. Then Sumner County, which is the next county over from Davidson County, they are bringing in right now at 268 positive cases. For comparison, here in Chattanooga and Hamilton County, we've had 61 positive cases thus far. And so as you can see, these numbers are continuing to go up, which is why it's so important for us to stay home to to try to, what we've said is flatten the curve. And when we talk about flatten the curve, if you look at a graph and how numbers progressively go up in these cases, so you want to prevent that curve from going up, you want to more keep it level or flatten it down. And so that's why it's important for us to stay home. So here in Tennessee, Governor Lee signed an order on yesterday, pretty much mandating now that its citizens stay home unless they're carrying out essential activities. And this was because previously it was just more of a recommendation, but not really an enforced mandate. And what they found here in Tennessee by looking at travel data as well as cell phone data is that people were going back to their old habits. Pretty much the numbers were getting close to pre-coronavirus levels of travel within the state. And so that's why now this is more of a mandate that people stay home unless they're going out for essential things. So essential things would be like food. Yeah, we certainly don't want you to run out of food. A medical office visit if you needed to see your doctor, or if you had to travel to a hospital, pick up medications from a pharmacy. Those are things that are essential. Some things that aren't as essential is, going to get a new lawnmower, or going to buy some paint because suddenly you realize you have more time at home, so you want to paint your wall. But that's not considered essential travel or an essential need at this moment in time. Other things that are taking place as a response to these increased growing numbers of positive cases here in Tennessee, and concern with overcrowding of hospitals and healthcare facilities. What they have started now is to create alternative healthcare facilities. And so what's thought to happen is that as hospitals become overwhelmed, and as you want to keep as many of those more severe cases within the hospital, you can send some of your less severe people who may need to be monitored or watched but may not require a ventilator, for example, to one of these alternative healthcare facilities. So here in Chattanooga, they have designated the Chattanooga Convention Center, and close to us is the Knoxville Expo Center, to serve as COVID positive, non-acute alternate healthcare facilities. And you can learn more information about that on the Tennessee Health Department website. They have it detailed and listed out there for the public to see what the game plan is and what the response is. So, in just looking at all this data, it just really, makes you reiterate to people that it is important to stay home right now. And so the other thought to that, like I talked about, I've seen people say, well, since I'm staying home, now I'm eating and I'm concerned that I'm going to gain that COVID-20. And so I wanted to share with you some tips to avoid weight gain while you are still being within those stay-at-home guidelines and those stay-at-home recommendations. So tip number one is to stay hydrated. I know, for a lot of us, once we're inside, we're at home, we just don't feel like we need to drink as much. We aren't moving as much, so we aren't as thirsty. Or if we're drinking something, it's just, something flavorful and not really drinking water. But it's important to stay hydrated, because when you stay hydrated, particularly with water or a non-sweetened type of beverage, this decreases your appetite. It helps to regulate your body temperature, and it delivers these vital nutrients that your body's cells and your organs need to function, as well as removing waste from your body. So it's important to stay hydrated. So while you're sitting, you may be watching your Netflix, or you may be teaching your kids or doing an art project with your kids, but keep a cup of water handy, or a bottle of water handy nearby, so that you remind yourself to drink and to stay hydrated while you're home. Another tip is to avoid snacking out of boredom. For a lot of us, when we're at home and we feel bored, we can't go out, we can't do our normal activities, so we just snack. The food's there. You've piled up your couple of weeks of food to stay within the stay-at-home mandates, and so the food is there. And so it's easy just to say, I'm just going to have a snack as something to do. So try to avoid that. And a couple of ways that you can try to avoid that. One is being mindful of your eating. And so when we eat, try to think about, well, why am I eating at this given moment in time? Is it because I'm truly hungry? Is it because I'm bored? Is it because my body is telling me I need something specifically? So think about why you're actually eating. And usually, if you actually put some thought into it, you may not necessarily need to eat at that given moment in time. Or if you do need to eat, it may remind you to choose a healthier option versus just that quick snack out of the pantry that may not be as good for you. Another tip to avoid that snacking is intermittent fasting. So intermittent fasting is it's not new, but it has gained more notoriety within the past couple of years. And so what that is that you picking an eating window of time that you would like to eat. And then you fast. And when we say fasting, it's not fasting like not having anything at all, but fasting in terms of still staying hydrated and hydrating on very low calorie or non-calorie type of drinks within that fasting window. So for most people, even a uh, 14-10 type of fast is a good approach to go, or a 18-6 type of fast is a good approach to go. And so what that means is that you pick a window that you are going to eat. So whether that be you're going to eat between noon and 8 o'clock. Then from 8 o'clock, you're not going to eat anything else because you'll probably be getting ready to go to bed soon. And then you won't eat anything else to noon that next day, but you'll just drink and stay hydrated. And so what that does is, one, it creates a routine. And so your body gets used to saying, okay, well, I'm not really hungry right now, so I'll get on this routine. And it gets your body to more of a steady state in terms of burning off those calories and burning off fat. In a way to help you maintain your weight or to lose weight. Of course, if you have some special conditions or you take certain medications, that specifically medications that have to be taken with food, then this may not be for you. And always I recommend you talk with your doctor before starting any type of new diet or dietary change. But for some, this may be an option to help prevent that boredom snacking and to avoid that weight gain. And then the other thing is just being mindful that when you're at home and you aren't moving as much, you aren't doing your usual activities, you may not need as many calories to fuel you within your day as you previously did when you're on your normal routine. So just being mindful of that also, to say, for those people especially who may keep up with their calories and say, well, usually, I require 2,000, 2,500 calories a day. Well, now that you're inside, you may not need quite that much. So that's another discussion that you can have with your doctor. Maybe they can recalculate for you what your caloric intake should be when you're more sedentary, so that you can have a healthier approach to it and avoid from overeating and adding too many calories into your current diet. My next tip is with exercise. So we've now been mandated to stay indoors, but that still doesn't mean that we can't get exercise. There are a lot of indoor options for exercise. One, if you have stairs in your house, climb the stairs, do it intentionally. Go for, at least 10-15 minutes if you can do that, of just climbing up and down those stairs. If you've got some boxes or things to move around, even better, adding a little weight and strength to it. So you can climb the stairs in your house. Jumping jacks you can do in your house, or if you are living in an apartment or a shared living place, maybe just go on your porch and do a couple of jumping jacks for 10-15 minutes or so. But just get your body moving. Some other great indoor activities are body weight type of exercises. So those body weight type of exercises can be planks, push-ups, things of that nature, things where you use your body as the actual weight to help with strengthening your body there. Some other things, dancing, particularly Zumba. Zumba is a trademark type of dance workout, and you can find some Zumba workouts online. And you can even find some instructors who are teaching live online Zumba classes. And so dancing is a great way to get indoor exercise. And then your streaming apps. So things like YouTube, Instagram has live, Facebook has live. And so there are a lot of fitness trainers on there right now who are offering just free workouts, or, if you're within a group, maybe a paid workout or something. But these are great ways to get indoor exercise and to get your body moving and to burn off some of those calories that you may be consuming while you're indoors. And then my last tip is always remember to get proper sleep, especially right now. And as we know, lack of sleep as well as stress does promote weight gain. And so if you're trying to avoid weight gain and or you may have some weight that you need to lose, you want to make sure you're getting proper sleep, at least that 8 hours of sleep at night. If you can get in a nap to get a little bit more sleep to refresh your body, to regenerate those cells, to reduce those stress hormones that promote weight gain, that would be awesome, to just make sure you're getting proper sleep. A couple of tips to make sure that you're getting proper sleep is to turn off those screens at night, get away from social media at a certain time of the evening so that your brain can slow down, it can relax. There are a couple of meditation apps out there that help, will read you a sleep story, or will give you sleep music, or there's some other apps that are out there to give you white noise and sounds to help you have a restful sleep. Um, and so, yeah, so these are my tips to avoid weight gain during the stay at home mandate. So just remember, it is important to stay at home right now, at least for these next 2 weeks. Let's flatten this curve. Let's prevent further spread and further healthcare problems, further deaths in our country and in our state, by staying at home and following these recommendations. And then just, you can use these tips to just keep yourself healthy so that you don't have to be concerned about the COVID-20 while you're at home. The essence of health is in you. And I will see if I have any questions right now. And if there are questions, feel free to leave them in the comment section of this video, and I will be happy to answer them in the comment section. I do want to put out a reminder that Essence of Health Wellness Clinic is still accepting new patients within the clinic. And so with your membership, telehealth, particularly video visits, text messaging, phone access has always been a part of the membership program here at Essence of Health, and that's still a part and a way for you to still obtain health care and not have to worry about lack of health care during this trying time. And as a part of promoting affordability in healthcare, Essence of Health is currently waiving its enrollment fee. So there's no enrollment fee to join right now. It's just your monthly membership fee. So feel free to check out more online at essenceofhealthwellnessclinic.com. You can send an email to essenceofhealthwellnessclinic@gmail.com, or feel free to call the office at 423-225-2245. Thank you for joining me.